Hello, my name is David, and I have a severe sleep disorder. I'm making this video to share my journey and possibly help folks that are having the same issue I'm having and share my experiences. I've been through a lot, and maybe I could help someone out. I'm also making this video to learn if you're currently facing the same issue and you have found things that have helped, please share. So I'll apologize in advance. I'm going to kind of jump around. I've been through a lot over the past 10 years, and I'll try to stay on course, try to follow me, and I'll try to make this as quick as possible. So 46 years old, I'm about 165 pounds, and I've been struggling with a severe sleep disorder for about 10 years, like I mentioned. So I'm gonna rewind and kind of start off, how did I discover I had an issue? So I first started waking up, 2 to 3 a.m., a couple times a week with a headache. It would be towards the back of my head, and it would be kind of a pretty bad headache, but I guess I would describe it as dull. And I would take a couple of Tylenols and I would go to sleep. After that, I would fall back asleep. 15 to 30 minutes, it would go away and I would fall back asleep. And I would function, that lasted at least a couple years. Then I developed severe insomnia and anxiety and just really bad sleep with the same headache. So I finally saw a doctor. It didn't take much description of my issue. He's like, I think I know what you have, and I'm going to give you a sleep study, and we'll see what comes back. So that was an in-home sleep study. I did that. I came back with severe sleep apnea, stop breathing, AHI of about 31 per hour, and they gave me a CPAP. I tried that. I tried the CPAP, had high hopes, did a little bit of research of what I needed to do, tried a couple different masks, but I gave up pretty quick. I don't think I slept the whole night with the CPAP machine. So I still needed to find a solution. So I continued my research because I was still struggling. CPAP wasn't working. I gave up on that. So I came across Inspire. So I looked into Inspire for about a year. I joined their Facebook group and saw a lot of positive reviews. I think I had the Inspire surgery done, I would say 2021, 2022. The dates are kind of fuzzy, but locally here in Central Florida, we have a top Inspire surgeon, Dr. Tipperini. So I made an appointment with him, had a sleep endoscopy done. They put you to sleep. They run a camera down and say, yep, it's your tongue and you're qualified. My insurance was easy to work with, and I was able to get the Inspire surgery. Recovery time was a breeze for me. This surgeon that I used is really good. The scarring is barely nothing. And yeah, so I tried Inspire, and it takes about a month to heal, and then you get activated. And I was able to go through the basic steps of a low setting, and I think a really low setting, you could barely feel it. And Inspire doesn't hurt if you're curious about that. And you have a little remote to turn it on. I was able to go from like 0 all the way to like 10 of the initial settings. Keep in mind, these are very low, but no relief. Still struggled, still waking up a bunch of times per night, waking up headaches, crazy dreams, which I still have to this day, anxiety-ridden dreams, very vivid. So that wasn't working. So I would go back to my doctors, try to make different settings. So ran the course to Inspire. After being activated for about a year, I had to find something. So I kept on going, found some information on UPPP. I read reviews that it doesn't work. It hurts like hell, but I have to do something. So thankfully, the same surgeon that did well with Inspire, he also does UPPP. Insurance paid for it, had that done. I have to say that the recovery for that wasn't as bad as a lot of people say it is. I mean, yeah, it hurt. I guess to describe that was, yeah, if you swallow glass, that's, you're gonna have a really bad throat pain, but that didn't last too long. I mean, the first couple of days were bad, but that didn't work. So I immediately, after having that surgery, I figured out that first night that I had the same little issue where once I doze off and I have any problems with breathing, I wake up. So that was very disheartening to learn that wasn't working. So to summarize, UP3 I did notice after it healed and I continued to struggle, it didn't look, I'm gonna show you real quick. There it goes. That's my surgery. As you can see, they took my tonsils out, but I had like a little piece of skin hanging, and from everything I saw from online, the surgery was a complete arch like I have now. So I went back and he said, you know what, a stitch might have came out. I said, could that be causing my issues? He said, maybe. So I went under again. So technically I've had 2 UP3 surgeries, and that made it worse. So would not recommend that. It definitely made my breathing issues worse. I don't know if it narrowed the airway, whatever it is. I think it created more of a pocket for my tongue, a perfect little pocket, and not having that extra skin to kind of keep things maybe out of the way. It almost created more of a vacuum back there. So it's worse for me. All right, so we talked about Inspire. We talked about UP3. So other than continue to struggle, I had to go somewhere else, and I tried CPAP again. And I tried that, I think, maybe the end of 22, beginning of 23. And the good news is I was able to get used to PAP therapy, CPAP. Started with the basic settings, the low automatic settings, tried different masks. I could say I've tried every mask out there. I've tried from full face mask to nasal to the halo, the bleep sleep, the old ones, the new ones. I probably spent $800 on masks, buying them out of pocket myself, or more, I don't know. My struggle with anything that's not full face is if it's nasal. I know about taping the mouth, whatever. My cheeks would puff out when I doze off and fall asleep. So that would wake me up. So the full face mask keeps things kind of tight. But I didn't improve with the CPAP. So I continued my search for CPAP, and I said I was going to jump around, but try to follow me. Amongst all this, I'm seeing doctors prescribing sleep aids. I tried different ones. The only one that didn't make my skin crawl and I was able to tolerate was Lunesta. That let me fall asleep. It wouldn't keep me asleep. I used that for a while, but I don't like pills, so I would take myself off, and the good news, I'm able to kick that pretty easy. So Lunesta, on and off of that, but trying PAP therapy. So continue to do my research, and I found the lanky lefty, Jason, out of California, I believe. Good guy, cool dude. And had some sessions with him. He looked at my data using Oscar or whatnot. And he said, yeah, I know. I've talked to many folks like you. You need more pressure. Tried more pressure. I think it was like, look, go up to 18 with or without EPR. I tried that. And I think I was able to fall asleep on those higher pressures, but still would wake up. Then you need bi-level. So I bought a bi-level machine, tried that. Same issues. No real relief. So by using PAP therapy, CPAP bi-level, it's better than not using anything. Okay, so tried his methods, and unfortunately I never tried like 21, and I mean, he mentioned 21, but that's super high. That's something that maybe I'll still continue to push for on maybe bi-level, but we'll see. Okay, so that didn't work. So then what do I do next? I continue doing my research, and I stumble across some videos about upper airway resistant syndrome, UARS, UARS, whatever, and Dr. Krako. So his first early videos, I'm like, holy shit, this is what I have. I think I have this, because it described my issues. And I even got to the point where I reached out to him. I had a session online and paid out of pocket for that. He stopped practicing, gave me some information. A lot. One issue I was having too is having stuffy nose while using CPAP. That would happen. So he's like, look, you got to get over that. We have to figure out something. So he prescribed, I think not prescribed, but told me about every nasal spray. Tried those didn't work. Afrin was the only thing that worked, and we could talk about that. So tried that, and then I continued to do research and learned about his lab still operating. Called them up, and they were one of the only clinics that were pretty good over the phone. Like, yeah, it's going to be out of pocket, but it wasn't too bad. I think it was like $800 per sleep study, where some clinics bill thousands of dollars, $10,000 for a sleep study. So flew over there and was able to have some sleep studies done with one of his old techs that he trained. And I forgot the guy's name, but a nice guy. And what we tried was a CPAP, or a sleep study without equipment, sleep study with CPAPs, and then a dual mixed night on bilevel and ASV. It came out that I had shitty sleep on all of those, those studies, but it came out that I supposedly did better with a bilevel setting of EPAP 8 and pressure support of 4. I would try that at home, and it didn't help. Tried that. I looked over the sleep studies. One thing I'm not happy with is that I believe they don't really focus on RDI, and I don't think they rank that on the sleep report. I talked to Jason a little bit about it, and he said, yeah, because these two numbers are the same, they're not ranking it. And so there you go. Other than that, they were easy to deal with. So no relief there. I still struggle, even being compliant with some form of PAP. To me, CPAP, I actually tolerate CPAP more. I tried ASV. I bought an ASV machine, and the problem with ASV is that when I'm able to fall asleep with it, tried different settings on ASV, but when I wake up, generally the wake up in the middle of the night, or really any wake up, when I go to doze back off, that machine gives you a push of air that would wake me up, and I would get frustrated, and I would just take it off. So I was able to last a whole night of really fragmented sleep with the ASV with different settings, but long term, I can't do it with that. I wish there was a way to overwrite that. To me, that's ridiculous that it does that. I'm sure there's a reason for that, but if someone at ResMed, I got the ResMed machine, AirCut, AirCurve, ASV, or whatnot, and if you could overwrite that, you should, because I would be able to give it more a chance for ASV. All right, so we talked about my time with the sleep center over in New Mexico, and we talked about Inspire. Amongst this time, I tried different things. Dual therapy, where I would, take a little tongue retainer that I get off Amazon. I tried 2 different ones. One was really uncomfortable. One was I could sleep with, as far as keeping it on through my first portion of sleep. And I figured, okay, if being that they said that the tongue is the issue, if you're holding the tongue out with that retainer, it's like a little pacifier. You put your tongue in and it holds it out, and use CPAP. Hey, I'm good. That didn't work. Excuse me, didn't work for me. Okay. Also did dual therapy with Inspire, and I'm able to get to level 3. We're going to talk a little bit more about Inspire, and use CPAP, but I still wake up. So I'm going to go back a little bit to Inspire. So recently, probably about 6 to 8 months ago, I went back to see the original Inspire surgeon, Dr. Tipperini. I said, look, that sleep endoscopy you do? So I've had the titration in the lab of Inspire, and again, the results. One of the most frustrating things is when you have these sleep studies, you can have the worst sleep, but hey, you did good. Your AHI, all they care about is AHI. Your AHI is down. My AHI is actually next to nothing when I'm using therapy, but my sleep is still crap. Your AHI is down. You did fantastic. So I said, you know what, Dr. Tipperini, can we do another sleep endoscopy, but actually try to titrate me, like go through and go through the settings and see what you see? And he said, you know what, I've never done that, but I'm willing to do that. Let me reach out to some folks. He made his calls. Let's do it. So my insurance been great to work with, and the Inspire rep was there. They did that. They said, you know what, great news. We were able to get to like a level of 4 on your remote, and we saw the airway open nicely. So you should try to do that. I'm still working my way there to do that, mainly with dual therapy, using CPAP and that, because I've gotten to the point without CPAP, I can't really sleep. I got into that level. So that's where I'm at. So dual therapy. So here's an extreme measure I tried with dual therapy. I ordered an Alaxo airway stent. If you're suffering with what you think is UARS or have UARS, you probably know what that is. You order it, crazy, and it's a medical device, and you basically run it down your airway yourself using like another little plastic thing. And I did that, and being that my situation is so bad that I just have to try it. So I did it, and it wasn't that bad. I did it. I watched the videos, and I was able to get it down there and follow the directions where you get it down a certain level, and you should be able to kind of see it, and then pull it just back up and sleep with this thing in your airway. So I did that. Tried it without CPAP. Would wake up, then I tried it with CPAP. That didn't work. I think I tried that 2 nights, and it just got to the point that that's too extreme, and I didn't see any help. So gave up on that. That cost like $1,000. All right. So let's see. I'm going to back up a little bit. The CPAP, trying the different positive airway, tried the CPAP, bi-level, ASV, had numerous sleep studies, New Mexico, different doctors, and still struggling. So here I'm at. Here we are. I'm making this video, and wanted to share this little vein here. So went to the doctor with that because that would pop up generally when I have bad sleep. Really bad sleep. Every night is bad, but when I have some nights that are just atrocious, at least 2 times a week, that pops up. Went to my regular doctor, and she's great. And she said, you know what? I'm going to have a test done. She was concerned that could be something else. Something with the brain or something. That came back negative. Everything was good. That is sleep related. That is sleep deprivation. My headaches, I get a headache here. When that happens, sometimes it's worse. Sometimes it goes away completely, but there you have it. Okay. So I've been through a lot. So then I've reached out to, like I said, Craco, I also reached out to Dr. Park, paid for his consultation, but then I get an email saying, hey, I'm sorry, I don't do that anymore. I'm going to refund you. And I asked him, well, what else? What else can I try? And I believe he mentioned Dr. Simmons in Texas. So I have an appointment with them. We're in July, late July, I think to 25th of July, 2024. Next month, mid-month, I have an appointment with them. I believe it's through Zoom, which is great. There was another doctor in New York that supposedly does UARS. They literally come and fly to New York for your consultation. I made that appointment, but I said, you know what, I couldn't even get past their receptionist in scheduling. Can you ask the doctor? Can we? No. So I canceled that. I'm in Florida. And then, so Dr. Simmons, I reached out to him, and I do have an appointment with them. I know about the PEZ, where they run the sensor or whatnot, and they measure how hard you're working to breathe. I'm hoping they could titrate my CPAP, or if it's bi-level rate, whatever, to really optimal settings, because that's where I'm at. I know that's what I have my hopes for that. So jaw surgery, I don't want to do that. That sounds crazy. I know there's folks that have had that done, but I don't want to do that. But I think I've tried everything. I think I've talked about everything, where I'm at. I guess one message, if you're struggling with sleep apnea, if I could get used to CPAP or positive airway pressure in general, you can too. I went through all of this to just end up to where I started. So I listen to your doctors. You got to muscle through it. It is your mind, and if it's bad enough, do it. Keep trying. Try different masks. Reach out to Jason over at Lanky Lefty on YouTube. He's the most popular guy on YouTube that talks about that. Reach out to him, because there's some general stuff like leaks. You got to control pressures. Leaks are perfect for me. I don't have any issues with leaks. It's not that waking me up. Another thing I haven't talked about is I'm a side sleeper. I know that for a fact. I just roll from side to side. So I know that the sleep issues are worse when you're on your back, but I'm a side sleeper. But if I could get used to CPAP, I've gotten to the point where, it's kind of like my safety blanket. It comforts me. Obviously, higher pressures are a pain, but I could tolerate beautifully 10 centimeters of water pressure, no problem, with no leaks. Once I start going, I have my machine currently set to start at 10, ramp up to 13. I've gotten to ramp up to 15, but the problem is when I wake up, and I've gotten into a bad habit where I wake up, I'll roll to my side and ramp the machine because it's more comfortable. I do have the little, I forgot what it's called, but it's a little adapter you put in between the CPAP hose. Maybe I'll give that a shot. It's really popular now that they talk about it online. I tried INAP, that was crazy. Saliva, that's another machine. I think I've tried everything, different methods. And if I could get used to positive airway pressure, you can too. So if that's the thing I could help you with is don't go through the surgeries. Would I recommend Inspire? Not for me. I know that people have been successful with Inspire, but not for me. So if you're struggling and some of this has helped you, awesome. Comment. Maybe I'll make another video, and maybe you've gone through some of these things and have found help. So right now, my hope is on Dr. Simmons' crew to recognize my situation and also provide something that I could feel that I'm going in the right direction. Because one of the most frustrating things is I've kind of hit to a point where I think I've tried pretty much everything and I'm stuck spinning my freaking wheels. So Dr. Simmons, that's my hope that they could start giving me some advice to get me in my right path. And again, I've had some bad doctors to the point where they just cookie cut. I've had one sleep study done where they billed my insurance like $8,500 for a CPAP sleep study. Sorry if I've talked about this already, but kind of going all over the place. But they came back. The frustrating part is after the study, I felt like I slept like crap through the whole night. And then they come back and say, you know what, you did fantastic. Great job. All they measure is the AHI. They're not measuring the RDI. When I ask, look, do you titrate when you start seeing, flow limitation, start giving me more pressures? No, that would be contradicting what we do. So there's a lot. I would say 9 out of 10 sleep doctors, when you have an issue like mine, it's going to be frustrating. And I'm a small business owner, and if anyone wants to start, like if there's any medical professionals that want to start what I call a sleep rehab clinic, I think you should. I would pay at this point whatever it costs to have 100% attention and maybe have a series of 100% attention. You check yourself into the sleep lab and you just stay there until you start feeling like you're getting help. Nowhere does that I know of, but I think there's individuals that have severe sleep issues where your typical schedule appointments, schedule this. What about all the time that you're waiting for? That could get to your head. And at one point it did get to my head. Fortunately, I've gotten to a point where by using CPAP, I've got a consistent, something I could rely on. And I do fall asleep. With no sleep aids now, I kick the Lunesta. I'm able to fall asleep. My sleep hygiene is great. Cold room, great bed. Life is great other than my sleep issue. That's kind of where I'm at. So hopefully I've helped some folks. We're at 23 minutes. Maybe I'll make another video comment. If you have questions, if you have feedback, let me know. Thanks for listening to me rant. I'll talk to you soon. Thanks.